Hi, everyone. Welcome back to the podcast Hormone Hackers with your host, me, Dr. Annette. Yes, it's been a little while. I haven't been the best this past year. And goal is to do better. And it's February. So it kind of, we're a little bit into the year, but not so far into the year that anything is a lost cause, right? And I did recently do one that was just kind of targeting into the immune system, just to give people some reminders about things that they need to do or how to take care of themselves in this rampant cold, flu, RSV, and all sorts of other junk coming around. So if that's something that you missed or you want to hear about, that is actually episode 6. So you can go back and listen to it. So yeah, this is episode 7. We're going to call this lucky number 7. And we are going to revisit the land of hormones. In the sense, I know that sounds, well, okay, it's hormone hackers, but I mean, revisit how it all balances out. So this is your little bit of an endocrine refresher, because what I want to talk about after this episode is I actually want to get into and talk about the thyroid. I've had a lot of requests for that, and it was something I recorded in the fall and then I lost it. So yeah, your host is not exactly the most tech savvy person in the world. And I'm also going to, I kind of want to qualify this. The style of it might be a little bit more of a rant, like a little more soapboxy kind of feeling. And especially when it comes into how I feel about balancing hormones and the way that I think is, should be done first and foremost. And the way it's done should be last resort. So you have to forgive me a little bit if it's a little bit preachy, a little bit ranty, and probably going to piss some people off. But you know what? That's okay. If I piss someone off, then maybe I'm doing something right. But also remember that the whole goal of this podcast is really to educate, right? To educate you into, understanding your body better, because I think we all can do that. And also so that you can ask better questions. But you got to remember who you are asking the question to, so to speak, is that, a lot of times people come to me and they've got these great questions that they're asking their doctor, their primary care physician. Maybe it's their cardiologist, maybe it's their OB-GYN, whoever it is. And the questions are great, but they're asking the wrong person. They are looking for a natural solution, but the person that they're asking, the only solution that they can offer typically is drugs or surgery. Sorry, you have to live with this, blah, 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 whatever that is, right? Which is, none of it is good. And, I think in this age of information, you gotta ferret out the good and the bad, because there is just honestly just a lot of shit out there, and there's a lot of crazy stuff out there. And if you just fall for the trap of an influencer that is making money off of making something look good or falling for marketing, we can just get really, a little bit lost, I think. So this is to help you have a better understanding so that you can ask better questions. Whether if you are my patient and maybe something has come up, and I recently have had some patients come back to me after being gone for a little while, maybe this will also, help guide our future, consults, visits together. Or if you work with somebody else, ultimately it is an honor to do what I do. Like, it is an absolute honor that I do not take lightly to have someone's trust for me to help them on their health journey. And anybody that you work with should feel like that. Yes, it is also my job to know how to help you and to understand the body and to explain it in such a way. It doesn't mean that I'm not open to what's going on. And of course, you know better than anybody else how you feel in your body. But this should be a really good relationship that you have, with a healthcare practitioner, whatever that looks like. So, okay. I think that's enough. I did promise you, though, it might be a little bit ranty. I'm not going to guarantee that there is not going to be a curse word that comes out. Might just depend on how excited I get with all of this. Okay. So endocrine refresher. Let's talk hormones. Let's talk how these hormones are regulated. Because in case you forgot, this is really, really, really important. And it's going to be such an important foundation going on to the thyroid and adrenals and things like that, although we will definitely revisit it. So first and foremost, everything is regulated by the hypothalamus and pituitary axis. Hypothalamus is in charge of assessing what's going on downstream, what the hormone production is like. Do we have enough? Do we have too little? Based on that information, it's going to then send a signal to the anterior pituitary, which sends out predominantly stimulating hormones to the appropriate glands to get that hormone production. If we have the appropriate hormone production, right, then the signal from the hypothalamus kind of gets withdrawn, or we might see inhibiting instead of releasing. And essentially what that means, it's on a negative feedback loop. So a negative feedback loop means you're not doing something. I'm going to tell you to do it. The minute you do it, I'm going to quiet down. The positive feedback loop would be like, yes, you're doing that. Keep doing that. Okay, you did it. Okay, cool. Keep doing it. Keep doing it. Keep doing it. That would be like in this guise of like talking about a positive feedback loop. Predominantly, with very few exceptions, everything in the endocrine system runs on a negative feedback loop, which means it's very tightly controlled. And that is so important to get, that it is not, you can't just have a plethora, an abundance of all these excess hormones. That creates hormonal chaos, right? The other thing that is not talked about, but is the physiology of how the body works, is that when the hypothalamus sends a signal to the pituitary, specifically the anterior pituitary, it is going to cause an elevation of pituitary hormones, and it will always be more than one. There is not this just only one pituitary hormone in a response to one hypothalamic signal. So for instance, what this means is, let's say, for instance, this is a stress response. So corticotropin releasing hormone from the hypothalamus, we would think of it going to the anterior pituitary, and the anterior pituitary would release adrenocorticotropin hormone, which is ACTH, to get the adrenal glands to make more hormones. In particular, the predominant ones would be cortisol and DHEA. But it's not that simple. So when CRH goes to the anterior pituitary, not only is it going to stimulate ACTH, it will also cause a rise of TSH and prolactin. Did you hear that? That means that in a stress response, while it's going to the adrenal gland, it is also going to send a signal to the thyroid gland like, hey, we need more. And it's also going to cause a rise in prolactin. And this is really important because these pituitary hormones have a balance, or can affect your other main pituitary hormones, such as FSH, LH, and growth hormone. Like when you got these big rise of these hormones, it'll have a more suppressive effect on those. And honestly, I think this is how, if you're completely stressed out, it can actually rob you of your fertility, of your overall vitality. And what it points to me is that this is a very delicate system. It's very complex. And so when we think that we are smarter, that we can override it by giving, say, bioidenticals, this is where mistakes happen. Okay. So there's a little bit of the interaction of the pituitary hormones and why it's important to understand. And I'm going to talk about this with the thyroid, because the same thing goes if it was thyrotropin releasing hormone from the hypothalamus to the anterior pituitary, TSH would increase, ACTH would increase, and so would prolactin. Those same three pituitary hormones also elevate if it has to do with the thyroid, which kind of leans into TSH is so much more than just a thyroid indicator. So now we know there's these interaction with these pituitary hormones, but what it's looking at and what it has the most sensitivity to is going to be these free hormone states. So that means a hormone that is not bound to a protein, which more than 99% of our circulating steroid hormones are bound to a protein. In fact, all hormones have a protein that binds to them. So thyroid has thyroid binding globulin. Cortisol is CBG. We have sex hormone binding globulin for, the estrogens, progesterone, testosterone, and so forth. So our hormones exist in this bound and unbound state, but most of them are going to be bound. So they're there if we need them. We've got this beautiful reservoir, if you will, of them, but they're not just flooding the system. The unbound hormones, which are tightly controlled, regulated by the HP axis, by different enzyme pathways, liver and places like that, is really what keeps us in check and helps us to feel our best self. Before I move on, I'm gonna say this in another way because I want you to really, really get this. And I'm gonna share this like little thing that I wrote, trying to explain how this HP axis works. And I called it the HP axis basketball game. I love this analogy because it's very, very straightforward, right? So when we think about that, we have, the head coach. You could think of this as the hypothalamus, and you have your assistant coach, which could be the pituitary, right? Everybody knows in basketball, you have 5 players playing 5 players. That never changes. You don't get to decide to have 10 on your side of the court or 10 on your team out on the court while the other team only has 5. It's 5 on 5. Now, how many you have on the bench, which are there, like they're ready to go in, you can have as many as you want. And if we want to use a junior high basketball game as an example, chances are everybody makes the team. There could be 20 on the bench for one school, one team, and the other team maybe only has 10 or 15. Doesn't matter on the bench. They are inactive. They don't get to do anything with the game. They have to be put into the game to be able to shoot, score, foul, or what have you. Think of this as the players on the court are the unbound hormones. They're the hormones that are in that free state, which means they can elicit a change or a response in the body. The hormones that are bound to a protein are all your bench warmers. They're there if you need them, but they can't do anything unless they get pulled into the game. And going on this like junior high analogy, we also know that the bench does not dictate who wins or not, right? You could have 20 people on the bench, but you guys are all terrible players, and you're going to lose to the team that only has 5 players on the court and 5 players on the bench. You need to think about this because this is really important, because this is kind of like how we age. When we go into menopause, our overall amount of hormones is less than when we were a cycling female. Doesn't mean we're weaker. Doesn't mean we're not as strong, because we're certainly much wiser. So I feel like we're wiser and more efficient, which in a way you could think about it is that we do not need the same level of hormones and menopause that we needed when we were a reproductive cycling female with the potential to make a baby, right? That is the rise and fall of hormones that cause the menstrual cycle. Thank God that doesn't go on forever. I mean, really and truly. You may not understand this. You may think, oh, this is like really great, having my cycle, which I didn't mind it, but I gotta point out, by the time I hit 50, 51, and so forth, I was definitely ready for it to go away. And I wasn't afraid of it. I wasn't afraid of it because I know I'm just not going to shrivel up. I'm not going to dry up. I'm not going to automatically, gain 100 pounds or whatever all this stereotype crap that goes on. Because I do have a backup system, and my backup system is my adrenal glands. My adrenal glands have the ability and do make the rest of that steroid hormone family. They also make the precursor hormones to feed into that steroid hormone family. So really, the trick of going through menopause is to have really strong and healthy adrenal glands. But when I see, God, the fucking insanity that comes into play, I'm sorry, excuse my French, with these bioidenticals, it is as if we are broken, as if we're broken. We can't do it on our own. And so we obviously got to have all this extra help. And sadly, this is even happening in women before they get into menopause, having bioidenticals just thrown on them. But you get to menopause, you go to, oftentimes these are the ones that spout, functional medicine, anti-aging, things like that. Chances are, whether they do the appropriate testing or not, most of the time I find that they don't. All they look at is the bench. So they're testing your bound hormones and making a decision about what the players on the court look like, even though they're not watching them or seeing them. But I find, I get so frustrated because I find women, they're just put on all of them except for cortisol. They're put on progesterone, which can convert to cortisol, can convert to aldosterone, can convert to androstenedione, and downstream to all the estrogens, testosterone, and DHT. So once you give a ton of progesterone, you have no control where it goes. None whatsoever. You cannot make the assumption that it's going to stay just as progesterone because it won't. It's an upstream hormone that is there to convert downstream. I see that. I also see they're put on estrone and estradiol, which, by the way, estradiol is the strongest of all the estrogens, can promote autoimmunity, can promote cancer, does promote inflammation, does increase insulin resistance, interferes with thyroid hormones. So it increases thyroid binding globulin. Thereby, you become increasingly hypothyroid. They put you on testosterone. Sometimes this is a cream. Sometimes this is pellets in your ass. The testosterone can also increase insulin resistance. The testosterone can convert downstream to estradiol, causing a whole bunch of festering of all these other things. Oh, but wait, we're also going to give you the upstream hormone, DHEA, which can also trickle downstream and affect all of this. Now, on top of that, what I see almost always is now, because obviously, you can't function properly. I don't know what they're thinking, but this is dangerous. You're giving someone bioidentical hormones that their body should be making, and you are going to interfere with that regulation. I don't mean you, like you personally, but it interferes with the regulation of that HP axis. And on top of all of that, I will find many times over, that same woman will be put on a thyroid hormone, either just T4, such as Synthroid or levothyroxine, or worse, put on Armour thyroid, which will be T4 and T3. Let me be clear. Taking bioidenticals will never fix anything. It will not fix anything. You might feel better at first, but you do not get away with it. It's not like you can just take something that your body has had under this tightly controlled system and just blast it with a bunch of hormones. It's not going to end well. And the crazy part is, how long do you get away with it? Everybody is different. You might start feeling really awful and come undone within a couple months. Someone else, depending on their gut, depending on, their liver function, how well they excrete excess hormones, so many other things, they might seemingly get away with it a lot longer. Or it could just be that the dose that you are put on, right? For instance, I had someone recently, and she's put on estrone, estradiol. She's put on testosterone. Both of those are in a cream. She's put on DHEA. She was put on thyroid hormone. I think it was Synthroid, and also progesterone. Now, this woman's main complaint is constipation. And she's put on progesterone at 300 milligrams. Now, granted, it's oral, so she might lose some through, hormone conjugation in the liver. That's possible. But if you want to put this in perspective, you would give a pregnant woman 200 milligrams of progesterone to help her maintain a pregnancy where there's a threat of a miscarry. They will use prometrium. They'll give them 200 milligrams, right, in that first trimester to help maintain it. Now, when you're pregnant, this can be a very good thing because you're supposed to be in a high progesterone state. I'm not saying that all pregnant women need to have it, but at least you're honoring what the body would be doing naturally. But if I know that it's normally 200 milligrams and you're giving a postmenopausal female 300 milligrams, that's 1.5 times the amount you would give a pregnant person that you're giving to a postmenopausal female. Nothing about that makes any kind of fucking sense whatsoever if you think about it. Not to mention that if I was to look at, and I'm going to come back to a physiological dose, but if I was to do a physiological dose, so a physiological dose could be something that we would use postmenopausal, woman, goes into menopause, or abruptly goes into menopause, maybe because of surgery, and is really, really symptomatic. You could use a physiological dose for, say, 2 to 3 months to ease that transition, while you use things that help with estrogen modulation, her natural, hormone production of all the steroid hormone family, while you're strengthening the adrenals, improving the gut, improving the liver detox pathways. I can wrap my head around that, except it never freaking happens, like never. I can't even remember the last time I saw that done. Well, okay, I take that back. I did have a patient that was put on an incredibly small dose, but that is like the exception, not the rule. Now, go back to this patient I'm talking about, where she's put on 300 milligrams of progesterone, which again, don't know where it's going to convert, all these other things, which means it can actually also ultimately interfere with thyroid hormones, but she's already on some estrogen, which is going to interfere with thyroid hormones, but that's okay. We'll just put her on thyroid hormones. It's all insane, drives me nuts. But with that, if I was looking at, a physiological dose for a postmenopausal female temporarily, you would use 50 milligrams at the highest amount. She's on 6 times that. So we're on 6 times the physiological dose, 1.5 times the dose you would give a pregnant female. And all the while, progesterone is going to sedate the GI tract, because it does support the parasympathetic, but too much, you're going to have an overly sedating effect. In fact, to some degree, you might feel less depressed, but too much, you're going to feel depressed. So it sedates the GI tract, causes ligament laxity. For someone who is constipated, this is not a good recipe. Then you have the impact of where it can convert downstream, could be feeding more inflammation, promoting more autoimmunity, a whole nasty mess of other things going on. And just because something is natural, bioidentical, does not mean you can take whatever you want, whenever you want, especially when it comes to hormones. I constantly am dealing with trying to balance people's hormones, which is probably why I get so agitated and get on a rant about it, because I'm tired of cleaning up the messes. I see, women come in with breast cancer that is both progesterone and estrogen positive. How the hell did that happen? And don't tell me that it didn't, because it does. And I really do think we have it's funny. You see all these influencers and different people, and we can all get on our high horse about endocrine disruptors, right? Things that, block our hormones, increase our hormones. We look at, soy protein. We look at these different chemicals that affect our endocrine system. And yet it's okay to just give a bunch of hormones? No, it is not. It is not okay. You got to just stop it. Absolutely, just stop the insanity. And of course, I'm going to tell you right now, if someone else has put you on that and you're on a relatively high dose and you've been on it for a long time, don't stop cold turkey, but you need to get with someone who knows how to balance your hormones without giving you hormones. That doesn't balance anything. That is like you breaking your arm, and I'm going, whoa, well, you broke your arm. I want to make sure that you never break your arm again. And so I put your arm in a cast, which, okay, initially it heals, but then I'm like, no. It might have been good at first, right? But let me just keep your arm in the cast. Let me just keep it there, because that makes sense, right? Because then you could never break it again. What's going to happen to the muscle and to the bone? It will weaken. Your muscles are going to weaken. Your bone is going to weaken, because you need to use it. You've got to flex it. The same thing is if you're giving, excuse me. See, I'm getting so worked up. I'm making my voice dry, so I had to take some tea. What you do is when you're giving a bunch of bioidenticals, you make those glands lazy. You would never make the thyroid stronger by taking away its job. You're never going to find balance post-menopause if you take away the job of the adrenals, or you sedate them, or you get the system so clogged up with all these bioidenticals, making bile more sluggish, making, sedating the GI tract. So excess hormone elimination becomes poorer and poorer and poorer as time goes on. And then you're going to wonder down the road why you end up with some other autoimmune or cancer. Well, it can't be that, right? Can't be that. It's bioidentical. Well, I'm telling you, there's not a free pass. There is no shortcut free pass. It's kind of like going back to the weight issue. You want to lose weight? It's not enough to just eat less. You have to keep your blood sugar balanced. Your hormones have to be balanced. You have to have good elimination, strong digestion. You have to be sleeping. You have to do adequate exercise, not too much and not too little. When you try to bypass that, bad things are going to happen. We see it all the time. And I get it. For a short period of time, maybe you feel like Superwoman, or, the guys feel like Superman. But it is not the solution. You want the solution? You manage your stress, you get plenty of rest, you get plenty of sleep, you do adequate exercise, you clean up your diet, and you utilize the appropriate herbs that help improve our stress response. Because I'm telling you, stress is the ultimate thief of our vitality. Chronic, prolonged, unresolved, poor response, whatever you want to say to stress, that will rob you of your vitality. You want to have accelerated aging? Don't manage your stress response. You want to have, hot flashes, night sweats, poor digestion, a weakened immune system. Don't manage the stress response. Your stress handling, your adrenal glands are the ultimate backup system. They are the ultimate balancer. They are the ultimate equalizer, if you will. This is why we use herbs that are adaptogenic. We use herbs that help balance the stress response or make it more resilient, because it is not about eliminating stress. We look at herbs that, are estrogen modulators, right? That they can help balance these estrogen levels even in menopause, help with vaginal atrophy, help with vaginal dryness. We look at incorporating more bitter spices, bitter herbs in our diet or in supplemental form to help with peristalsis, to help with the microbiome, to help with bioflow, all the things that go on. Everything works together. And, my role as a practitioner is knowing how to support you in your journey, knowing which adaptogenic herbs to use, and making sure that they're the right quality. I mean, my God, stay off the fucking internet some days. I just on some hand, I kind of have this, I now have this new empathy for the medical doctors who are so frustrated with well, I Google this and I Google that. I'm kind of getting it a little bit, because everybody thinks they're an expert. Everybody thinks they're, and they're not but they think they're an expert, or they've got some company paying them to promote, a product or what have you. And granted, it looks beautiful. The marketing looks beautiful, but I'm telling you, you can waste a lot of money on stuff that maybe it is good for you, but at the wrong time, the timing of it matters. So it could be a good supplement, but if you haven't corrected some underlying issues, it's not going to be very effective. Or like I had someone, and I would say the supplement looked pretty good. It was this nice herbal combination. But the reality was she would have had to take 5 capsules to equal 1 tablet of an herb that I carry for the equivalent dose. And yet the recommended dose of what she was taking was just 1 a day. So I'm like, you're not going to get from point A to point B in any time soon. Or, so again, it's like working with the right practitioner can help guide you so you're not wasting your money. I get it. Good nutrition is not cheap. It is not. But when you take, good nutrition and you're taking high quality herbs, you also don't have to take as much. And the role of any practitioner, if you're open to it and you can hear it, is working on the lifestyle. I mean, I think that's the best thing. I think that's probably the best thing you could find off the internet. What is the thing you resonate with? Is it meditation? Is it yoga? Do you like to dance? Do you want to dance for exercise? There are, ways to journal. There's a lot of ways that you can incorporate lifestyle, but when it gets into these nuances and your body is kind of pissed off and mad at you, then work with someone who can guide you in the right way. It's kind of like I always tell people sometimes the reason I use labs as well as a really good health history. Well, first off, the labs are going to mean more with a good health history, first and foremost. But it's like when you go into, for instance, let's say your Apple Maps and you're trying to figure out how to get from point A to point B. Almost every single time it gives you three choices, right? One's going to be the quickest route, and then they get slower and slower. I feel like when you work with someone who's really qualified, they're going to help you pick the best route to get where you want to be. And it's always a journey, right? Like, because you're going to get there and then there's going to be someplace else you want to go. It might be, your first goal might be the journey to heal your gut. The second journey is I want to have more energy. The third journey, whatever it is, it's always this journey. But man, do you want the potholes? Do you want the construction? Do you want the road delays? What do you want? What do you want that journey to look like? That's the question you got to ask yourself. And and I always feel like this every time I work with someone, the clearer they are about their desires and the clearer I am about how we can get there, it becomes this beautiful relationship. So remember, asking the right questions to the right person, first and foremost. Take everything you see, like especially social media, take it all with a grain of salt. If you're reading into the research, read the research. You cannot rely on the title of a paper. That is clickbait. That is to get you to click on it. And oftentimes what is in the depth of it is going to be the exact opposite of what you thought you wanted to hear or you wanted to read. So do it with some discernment, right? Question things, but don't let someone just throw you on a bunch of bioidenticals, tell you that it's safe, tell you that you have to stay on it, you're going to be on it the rest of your life, or any of this other crap. You are not broken. You are just not broken. Your body wants to be well. If you will just give it the right tools, it's going to find its way. I do have some videos on my website, which is endocrine-wellness-group.com. We're going to add in some blogs that you'll be able to find there. I don't know if I figured out how to add them into the show notes, but I'm going to work on that, right? As I pointed out earlier, I'm not very tech savvy, which is, why sometimes I record things and then I lose them. So there's that. But hormones, I know. Hormones, I got this. I have some friends and some colleagues. We're playing with my new nickname, which could be Hormone Queen, which since I kind of like ABBA and Dancing Queen, I don't know. Maybe this will work out. But this I know, and I always go back to physiology and what makes sense, and then what does the body need to be its best self? Because I truly believe that we can all be better with the decisions that we make, be better with the things that we do, so that ultimately means that we feel better, which means it's a life in which we live better. So thank you for tuning in to episode 7. If you like it, please like it, click the like button, follow along. You can share it with other people. If you're like, still not sure, I think about her. I did drop some F-bombs and a few things like that. I'm kind of feeling it out because this is truly how I feel. And honestly, it's just one of my favorite words. But, it's okay. I always said in the beginning, I'm not for everyone, and that's all right. But if my information, honestly, if it helps even one person, it is all worth it. And that really is my goal. Okay. So stay tuned. The next one for sure is going to be on the thyroid. Don't know if I'll be able to do it in one episode, but we'll see. All right. All right. Y'all take care. Bye.